Hello, everyone. I'm glad to be part of the Megagen lectures today. I am Dr.Anas Damlakhi, oral maxillofacial surgeon, specialist in implantology from Germany. I'd like to invite you all to visit my countryland, Syria. Okay, I will begin with this quote. For us, as a ship crew, always they need a compass. They need all in the information to conceal very safe. For us as implantologists, the surgical guide and the CBCT, all these data, we have it. We have the virtual patient. Then we can have the best way to give him the best result. In the last days, it was always bone-driven implant. We look for the best bone, we put the implant and finish. Then we will have some problems. Why we doing this? Then we will not have regular spaces to put the prosthesis in place. But nowadays, we all make prosthetic-driven implants. Then we will have the best result for the patient smile and all his problems. As I said, nowadays the prosthetic driven our implant to the best place and the best guide. So we can work for the patient on the computer, have a virtual patient, make all the design, the surgical guide, maybe the prosthetic also. Everything will be finished. Just one visit, we will have the patient in place, and just one visit, finish all the work together. Extraction, put the implant, and make the prosthetic immediately. We should always take care of the harmony of the face for the smile, the interpapilla space, the midline. All these details should be with us to have the best result, the best aesthetic result for the patient. Otherwise, if we don't have the good experience or we don't study the case very good, we will have implants everywhere without any good plan, and we will have problems in prosthetic. So, what is the benefit when we doing everything digital? First of all, we will expect the patient will expect what we will have as a result, while he can see everything in his eyes before we start working. The other thing is we can solve all the problems before we start with the patient between the implantologist and the prosthodontist. Then we will not have failures with such a case. Then we will have the screw in the buckle, and it's aesthetically is very fail. Also, if we have a problem with the bone, we need to make augmentation or bone graft anyway, any other way, nerve lateralization, any suggestion of our plan will be done before we make the patient. So we will know all the details, 3D details of the patient to make the best way and the accurate solutions for the case. So it's always a simple case. If we don't make a good plan for it, it will be so hard. But any hard case, if was very well organized, if we have a good plan for the case, then we can move it to a simple case as a normal case. So always try to work smarter, not harder. Keep calm and do the best way to make it easy. So when we begin to fabricate the surgical guide and the prosthesis. We always should have the digital workflow, to have all the data of the patient before doing anything. Because if we start to make all our information on 2D data, then we will have such a case. We can't expect what we will have during the surgery. So, first of all, we should create a virtual patient. We should have his photographs in all cases, all positions. R2 gates will help us to have the whole information of the patient. Then we will have a face scan, the teeth, the gum, the bone, all the information in just one shot. Then we can have a virtual patient and start working on the case. Okay, while our plan should be prosthetic driven implant. So first of all, we should plan for the prosthetic, for the teeth, where we should put them. Then we will have a good plan for the case. Also, from our information or the virtual patient, we should know if we need to make a hard tissue graft, or with bioprinting nowadays, we can also make special bone grafts for the special case. We should take care of the depth of the implant to have a good support for the soft tissue. Then we might make a keratinized graft. Nowadays, with all on X, also we will have a good plan for the patient to do it. We should choose very carefully the abutment, the tie base, or the multi-unit abutment, what we need for the case. We should plan also for the prosthetic that we will have, if it's FP1, FP2, to make sure for all details. I will start with the case from Kristen Koshman, just to be sure of the all details that you will received very good of the case. Then I will start with my cases. First of all, we will have photos for the patient, 2D and 3D, facial and profile pictures in all sides, the occlusion view of the patient. As we see, we lose here the occlusion plane. Then we should deal everything. Smile design with a new way. We can try also the smile design and show it to the patient to evaluate the case. The intermaxillary connection, the relation between the upper jaw and the lower jaw. As I said, the plan for the prosthetic, that we can have the best place for the implants, the surgical guide in place with anchor pins, and then the multi-unit abutments, prefabricated, prosthetic, and the final results. Okay. I will start now with this case. I have a patient. He's 40 years old. He's suffering from problems in eating, in chewing, in smiling. He has a moving teeth. He has an impacted teeth in place. So we have the plan. We made the prosthetic part to make all the implants driven by the prosthetic. We see the place of the impacted teeth, impacted canine, and I try to save this part of the bone just to put the implant safe. Then it will be bicortical from here to here. As we say, we have designed the smile. We fabricate the surgical guide, and you already have the bridge before I touch the patient with multi-unit abutments. So I started to extract the canine. As I say, I try to save this part of the bone. Then I can put the implant save here with bicortical bone. The surgical guide in place. Then we insert the implants. With IceQ, it should be more than 65. Then we can make immediate loading for the implants. It's an important point. The multi-unit in place and the final prosthesis. The patient can have bridge immediately after putting the implant. So we can turn the imagination into reality with these techniques and with surgical guide. It's a video about the case. As we said before, the extraction of the tooth, the blend. We will talk about another case, more simple case. We have a root here in place. We have the blend. We make it also digital with a surgical guide and the prosthetic. The crowns are already here before we doing the implant. The surgical guide, we extract the tooth, put the implant in place. As I said before, the ICQ should be more than 65 for the immediate loading. We used here customized abutment. As I say, we should always choose the best crowns or abutments for the case. The implant in place. Okay. Another case, but with the old way. As we see, the patient has a mobile teeth, has problem in the gingiva. We make the extraction. We put the implant in place. And the normal abutments and immediate loading crowns. Okay. We use also the megagen implants in craniofacial prosthesis to retain them. Okay. Sometimes we have cases like this. He loses his eye and part of the soft tissue and part of the upper jaw. So we use the megagen implants and put them after we study this the medical CT. We put the plan to put the implants in the skull. This is the implants. We put it in the skull to retain our fashion prosthesis. And then the patient has this nice solution for his problem. Thank you for listening, and I'm ready for any question.